This video is regarding how will NEET PG 2025 look like. So hello everyone, I am Dr. Mayukh Hazra. I got AI at 29 in NEET PG 2023. NEET PG questions are usually set by the Delhi colleges, that is including the AIIMS Delhi, because as per one of the faculties, one of the paper was given in AIIMS Delhi also 2024. So this is not a foolproof evidence, this is a hearsay evidence. I have listened from some of the authentic and top faculties. For that only I am saying this. So it is a hearsay evidence. Coming to the first point that you should know is what is the NEET PG marks distribution. Let's see. Anatomy, it is 7 marks, physiology 6 marks, biochemistry 13 marks, microbiology 12, pathology 13 questions, pharmacology 14 questions, FSM 9 questions, community medicine 16. High weightage ones are the medicine, surgery, OBGY, pediatrics. Like this is the whole list. You can have a screenshot or you can visit my Instagram profile and this chart is given there. From this chart, we can understand and come to the inference that the most 10 high yielding subjects are the biochemistry, microbiology, pathology, pharmacology, FSM, community medicine, medicine, surgery, obstetrics and gynecology, pediatrics. These 10 subjects constitute 147 questions. If we put them in a graph, that is the major 4 subjects, the preclinical 8 subjects, and the rest all 7 minor subjects. So the preclinical subjects constitute 45% of the questions. The major 4 subjects constitute 35% of the question, and the minor 7 subjects constitute only 20% of the questions. And as you can see in the graph that more or less the number of questions in NEET PG has been constant over the years. So we can say that plus minus 1 or 2 questions here and there, this could be the marks distribution for NEET PG. But that doesn't mean that you should study only 10 subjects, because usse selection nahi hone wala. You have to study all the subjects. If you find this information useful and you are new to my channel, then do consider to subscribe to my channel. Coming to how was NEET PG 2024 different from the other 3 years of NEET PG from which the 200 questions came. Firstly, time-based sessions was present in NEET PG 2024, that is 40 questions, 42 minutes, 5 sections each. Long stem question in NEET PG, previously it was approximately 20% of the questions, but now it is approximately 50%. Image based questions were usually about 25% to maximum 35%, but this time it has doubled to 55 to 60%. If I compare the difficulty level, if I say the difficulty level of previous year NEET PGs was 60 upon 100, then in the NEET PG 2024 it was 70. So NEET PG 2024 is the benchmark, and you should expect like that kind of questions only in your NEET PG 2025, that approximately 50 to 60% questions will be image based, approximately 50% questions will be long stem based. Yes, they will consume a lot of time, but long stem means more number of keywords also, from which you can confirm the diagnosis. Like I give you an example of how long stem and image based questions were. So a young man who has returned from USA, develops fever, cough, blah 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 blah, everything is given. What is the most likely diagnosis or the causative organism? From this only we can see this is a case of histoplasmosis. You can remember by cryptococcosis, C for C, CNS, mucormycosis, M for M, that is mu, it affects the face and the eyes, and H for hilum. Hilum is present in lungs. So you can see in the given question, it has given bilateral hilar lymphadenopathy, chest x-ray, and he has history of fever, cough and breathlessness. So it is affecting the lungs and it is a case of histoplasmosis. Coming to NEET PG question types, direct previous year question repeats. It is approximately 5. Previous year in NEET PG 2024, direct 3 questions were repeated from NEET PG 2023. PYTs, if I compare, then it is the maximum load, that is 110 are previous year topic repeats. Common sense and applied, if I say, then it is approximately 35. So if you combine these three and if you focus completely on the previous year topics and you have the applied knowledge for all the subjects, then you get 150 questions. 30 questions will be based on the prop based knowledge, the knowledge you gathered in the professional exams, all the written answers which you have written, but you have not studied in recent notes. So if your prof is strong, then another 30 questions will come from the prop based exams also, and in-depth knowledge, it will constitute approximately 20 questions. Now if you want a NEET PG topic list, then you can have mine. The free version is also available. You have to just go into the description box below and there you will get it, or you can see my pinned comment section also, there also you can get it. And the paid version is including 2024 one. Now how are the NEET PG questions? It is basically a superficial exam. Like INICET, I had explained that it digs in depth of the previous year topics. NEET PG is a superficial exam. It goes through the surface, but in NEET PG 2024, a little bit of depth was also there. So you need to have complete knowledge of most of the subjects and focus on important common topics which are common in India, like the diabetic ketoacidosis, like the pemphigus vulgaris and foliaceus, meningitis, trauma, etc. The newer FDA approved drugs, questions related to the trials, core preclinical are rarely asked. These are specifically reserved for the INICET. They are rarely asked in the NEET PG. Image-based questions. Characteristic feature of image-based questions of NEET PG is that only 20% of the images are searchable, or the classical images. 80% of the images are not searchable. Maybe these 80% images are given from unpopular journals or from the stock of the examiner. We don't know that. Okay, so regarding this, I had made a video. If you want, then you can watch it by clicking the I button. So the problem, you understand that the classical images won't be given much. 4 out of 5 images will be non-classical ones. In that case, how you can deduce the answer is, at first you have to see the question stem. Like I explained in the histoplasma one also, we can see that the lung is affected. So from the stem only you can get the diagnosis. Image, if you even don't understand, then from the stem you can answer, or else image will aid you in diagnosing the condition. And try to have a digital image bank if you are not having printed notes. From printed notes you can have a view of images, because this blunder I didn't have a digital image bank and I used to make my own handwritten notes. So क्या हो गया, main defect आ गया INICET exam में, where the scrub typhus, this image was given, name the disease transmitted. So I thought it was a hard tick and I marked it wrong. So here the importance of digital image bank comes. Even if classical images are not given, which are given in the digital image bank or in your printed notes, then also it will help you in understanding the condition and it will help you in diagnosing. क्योंकि क्लासिकल इमेज जैसा ना भी हो बट सिमिलर तो होगा ही ना, बिकॉज दोनों ही सेम चीज़ है. So if you want to have my image bank, then it is given in the description box below. Till now 8 subjects has been released, that is the preclinical subjects and the paraclinical subjects. Lastly, the NEET PG shift 1 marks versus rank. If you want to see, then with 620 marks in NEET PG 2024 shift 1, why I am taking shift 1? Because shift 1 was more like the previous year NEET PG. So with approximately 162 corrects, the rank was 2000. With 600, 158 corrects, rank was 4000. With 580, 155 corrects, the rank was 7000. 560, 152 corrects, rank was 10,000. 542 marks, 148 corrects, 15,000. 520 marks, 142 corrects, 21,000 rank. Since the exam is on the similar time in the August month only, so more or less if the question standard is same, the cutoff is going to remain more or less the same. Maybe a bit of increase in the cutoff can be happen, and this completely depends on the type of question because students are prepared well. And if you want to know what is the ideal cutoff, then one video is already there on my YouTube channel. It has over 35,000 views. So I am giving it in the I button. You can go and watch the video now. Coming to the approach to session-based exam. Since this time the exam is session-based like the previous year, what you should do according to me is that 40 questions, you have 42 minutes. So every 8 minutes, try to attempt 10 questions. Any question you are having confusion or it is taking time, leave it. Okay. So in 32 minutes, you will complete 40 questions. In the last 10 minutes, go review those questions. If you have completely reviewed those questions also, return back from the question number 1 and review all the 40 questions. Because many a times there may be mistakes. You may have seen something wrong, but if you double check it, it will always be correct. So try to follow this technique, and for this you need to give more and more GTs and follow this technique. And daily exam simulation you can do by solving 40 questions in 32 minutes daily. Then only it will become your habit. Finally, this is just a statistical analysis of NEET PG that has come over the years. So this is also based on probability. All faculties make revision notes. They are focused on the previous year topics. So they are also working on the probability that the important topics and the previous year topics can be repeated. So this is also an overview of NEET PG exam based on probability. So this is up for today. All the best for your NEET PG exam.